Hello, good evening. It's our weekly Facebook Live again. So today our topic is about something that everyone will experience. It's just a matter of time whether you are 50, 60, 70, or 80. You might think it's sexual health, but actually it's not. It's actually knee pain, okay? So some people will experience knee pain at earlier stage of their life, maybe 40 plus or 50. Some people might experience it later in their life, maybe at 70 or 80, but somehow at certain point, you will start to experience knee pain, okay? So tonight, we are so happy to have our superstar, Dr. Daniel, on board to do Facebook Live with us. I heard that last weekend he was a superstar in IMAS event, okay, which I missed because of home quarantine. So, Dr. Daniel, how was the IMAS event?
Wow, yeah, and I tell you, you miss a lot. It's a blast. I mean, have been 2 years that we can't really have, face-to-face
Physical.
discussion. Where in the conference you are free to ask questions, where you can talk personally, sit next to the speaker, talk to doctors, explain about science. Everything is great. Everything is great. I think everyone have a great time there. Mm.
Yeah, I think especially after 2 years of online webinars and online events, and now this is the first, I think for many doctors this is the first physical event that is happened. So I heard a lot of good things that I miss, unfortunately. Okay, so today we are talking about joint pain. Okay, so Dr. Daniel, maybe you want to actually explain to our audience what is this osteoarthritis, the joint pain problem.
Okay. Again, knowing me, I come from the science lah. So osteo again is bone. Osteo in medical is means bone. Arthritis means inflammation. So when you put two words together, it means that there is inflammation going on in the bone area. And of course, this can happen in many places. Depend where you use it more. Some, people who play tennis have tennis elbow is one kind of
Yeah.
arthritis. Shoulder pain, but in Malaysia, most of us actually suffer from knee joint arthritis. So that is one of the biggest challenges we have lah.
Okay,
So
so especially for athletes, you always have this problem, whether it's tennis elbow, whether it's golfing, running, hikers, and things like that. You prone to have all this type of pain. So, who is actually more susceptible to OA actually?
I mean, like what you say just
Runner?
now, athletes,
Sorry,
because just like what you say earlier, athletes. Actually,
athlete.
the joint damage happen when you overuse it.
Mm,
Our joint normally is the structure. You have two bones. Then after that, you have a gap in between. And
mm,
before bone happen, there is a soft tissue, what we call chondrocyte, which is a soft tissue. Think it like a brake, a cushion for the brake, our brake for our car. So it prevents from overusing of the brake. Same thing, but once you overuse your joint, so the chondrocyte will slowly go thinner, thinner, and thinner until at a point that now bone is hitting bone. So
mm.
when bone is hitting bone, that is where you feel all the scratching sound, all the pain, inflammation happen. So imagine, like what you say, athletes use a lot of their joints. Even day-to-day personal life, if you know someone who requires to walk a lot, sales personnel, stand a lot, they will suffer from OA as well, or arthritis as well. And like what you say in the starting of the video, where everyone as we age, the chronocyte will go thinner and thinner anyway. So actually, most of us or all of us are susceptible towards it.
So I think the question is because everyone will face this problem, and nowadays most probably human can live up to 100 years old. Don't be surprised. I would think we will live up to 100 years old. So if you would to experience pain earlier in your life, like 40 or 50, then
Mhm.
you need to suffer another 40, 50 years, right? So if you were to only start experiencing pain later stage in your life, then of course, your suffering will be less. So today, of course, Dr. Daniel want to talk a little bit about this joint pain issue. So actually, what is the main causes of OA? You see, a lot of times we say athletes, then it's also good to be active, right? Physically active. But physical active people are more prone to OA issue. How can they actually prevent it, or actually what are the main causes? At least you know the main causes, you try to avoid it.
Yes, I mean, the main causes is like what I say earlier. You use your
Dr. Daniel, you're
joint.
getting softer and
Okay,
softer.
sorry.
Speak
So,
order.
the main cause of OA is actually you use your joint. So just unfortunately that we are not vehicles. When our car, the brake overuse, we can change one, but for us, we can't change. So OA or knee pain is actually something you can't avoid. Just that if people which is more easy, or more susceptible to OA, then we'll advise them not to do certain exercise. For example, people who are bigger in size. Okay, because
Okay.
imagine big size people, you have more weight for your joint
Mm.
to tahan. Okay, they need
Okay.
to bear more of the weight. But if you walk a lot, then you tend to, if you scratch more often, it will damage the joint more. So normally this kind of patient or personnel will advise, don't go for jogging, don't do things with high friction, try swimming, because swimming is
Okay.
have less friction to the joint, less pressure to the joint, so that you can still stay active, but at the same time try to protect your joint as much as possible. So that is one
Okay.
kind. Then physiotherapy. People
Mm.
who use your joint a lot, you need to make sure that your posture is right, how you use your muscle is right to avoid more damages. So go for physiotherapy, get your advice. So that is also another way to prolong the usage of your joint. But
Okay.
the sad thing is, so far we have no technology to replace the whole knee yet. We can only replace
Okay.
it with metal alloys. Yeah.
Okay. So again, I always say that you lose weight to so that you can exercise. Don't exercise to lose weight, because when you're too overweight, actually,
Mm.
it's really not good to stress your joints or stress your system to exercise. So it's always good to lose some weight first,
Mm.
especially obese. Lose some weight first so that you can start exercising. And of course, people who are very active in doing exercise, or you are athletes, or you play badminton, or always look for proper chiropractor or even physiotherapists to make sure that you are always like doing alignment, right?
Yes,
Like
yes, yes.
servicing your body so that you
Mm.
can have a more prolonged uh, so that you don't get OA so easily lah.
Yes.
Okay. So just now you are talking about knee replacement, but I heard that even after you do your knee replacement, there are still a lot of pain.
Yes, it actually is a very invasive surgery where it's an open surgery where they will remove the damaged or bone, your leg bone, and then replace the joint with a plastic one or a metal one. It used to be, the tagline was do once and it will sustain you for life. It used to be.
Mm,
Because last
mm,
time we see patient having to undergo such surgery at the age of 60, 70, and that alloy joint or artificial joint can last for 15 years, or I mean 20 years, depend on quality and manufacturer. But unfortunately now we are seeing younger and younger patients, even like what you say, 40 years old need to undergo the surgery, and let's say the artificial joint can tahan 20 years perfectly. Then when it comes to 60 years old, you need to undergo another open surgery at the age of 60. And let's say, like what you assume that we can go to 100, means that at the age of 80 and 100, you need to open up again the wound. So
yes.
it's actually very pity. It's very, very
Yeah,
sad.
so people used to, lifespan used to be not so long, but now that
Mm,
the lifespan is longer and longer, I think it's really important to make sure that we also take good care of our body right now, so that we can make sure all our body can function well up to 100 years old. Okay, so like Dr. Daniel said, I think if you were to operate at the age of 40, maybe your recovery is still good, but 60,
mm,
it will be definitely more difficult. At 80, you're like basically increasing your risk
mm,
tremendously, right? Your
mm,
recovery will be slow. there will be high risk and maybe
Yes.
the pain that you need to go through. So what are the solution that is available right now?
Okay, this is like what I normally teach in my class. When come to the subject of OA, we always start with what we have now. Okay, what we have
Okay.
now. What we have now for OA is actually what we call management. It's
Mm,
not
mm,
curable, it's management.
mm.
So we have two types. One is what we call a non-pharmaceutical, means that you can do
Okay.
education, you do physiotherapy, chiropractic, you do
Mm,
exercise, you know. So those are one category which
mm,
only helps if you are in knee pain, not
mm.
OA, not
Okay.
osteoarthritis. Just starting to feel some knee pain. Yes, it might work because more is more of a preventive
Mm,
medicine.
mm,
But once you step into the stage of OA, then you need proper medication. But even proper medication, what we can do is oral painkiller.
mm.
If oral painkiller don't work, we will start to inject through the knee joint. Either you put in painkillers, steroid-based painkillers, or nowadays they will put in PRP. Some clinic do PRP, or maybe just HA, hyaluronic acid. Unfortunately, all those are just management. It don't really cure the root cause, which is the
That
damage of your.
doesn't improve the
Mm,
problem lah. Basically,
yes.
it's just temporarily relief of the pain, especially
Mm,
if it's painkiller, you just inject the painkiller. Imagine it's just temporarily
mm,
relieve the pain, but you are not improving the situation. You're not going to the root
yes.
cause. So PRP, how effective is PRP in OA?
Okay. For me, actually, PRP is already considered a big breakthrough. You know, because
Okay,
PRP is already in the field of regenerative medicine, which is my field.
okay,
The problem of PRP is that it is from patient own blood. Okay, it's
okay.
patient own blood, and like what we know, as we get older, the quality of the platelet or the amount of the platelet in our blood reduce. So
Yeah,
whenever
especially if
you
you're saying at the age of 80, right? Imagine
yes,
your
oh,
platelet quality
even
might
even
not be as good.
60, even 60, you see reducing on your platelet. But the problem
Yeah.
is, the ironic problem is that we don't get OA until we are old enough. But when we are old enough, our blood quality is no good anymore. So
So
that is
how
the
about
problem.
HA? I think a lot of people are also doing HA injection.
Yes. HA is like filling up the gap. So now the
Okay.
problem is that bones are crashing on bones. Okay. So
Mm,
what happens is if we put in a fillers in the middle, so that it can prevent the bone from crashing each other. So it
okay.
allows you to feel less pain, but it
Okay.
is not going to regenerate anything. It is
Okay.
there to separate your bone so that you don't crash each other. That's all.
Okay. Okay. Just put a cushion there, lah, but basically
Yeah.
it's not actually helping you to regenerate anything. So
Mm.
how about regenerative medicine? We have heard so many clinical studies talking about stem cells, exosome that can actually help in OA problem.
Yes, this is where my field, which I like it a lot, because regen med is something different from temporary solution. It try to regenerate the root cause of the disease. So, like when you say there is a lot of clinical trials talking on how to use stem cell to regenerate, the logic is behind if we inject sufficient amount of stem cell, the stem cell will start to replace or regenerate the damaged soft tissue, what we call chondrocytes. Okay, so when you replace that, it's actually that is a root cause. And if you replace that, then you actually have a permanent solution until you've used up this layer again, and then you need to
Okay.
replenish. Yeah, so that is a concept why people trying to use RegenMed in
So
osteoarthritis.
this will same apply on tennis elbow as well, is it?
Same thing, same thing.
Okay.
Yeah, to
Okay.
regenerate the
So my
damaged soft
question
tissue.
is, like me, I also experienced knee pain, right? So
Mhm.
I was also one of the first candidates that I joined the clinical trials that Dr.
Mm.
Daniel is doing. But when I went there, they say no, I'm not even qualified because I don't even have OA stage 1. So how do we actually diagnose whether
Okay.
because I know that I have knee pain, but maybe after hiking, so maybe it's muscle pain only, not really the OA kind of pain. So how do we know whether we are OA stage 1, stage 2? How many stages are there, and how do we diagnose?
Okay, for your case, it's different because you are joining a clinical trials where we have inclusion criteria. So you are still having knee pain, but it's not at that stage yet. So
Okay.
coming back to how many stage we have, we actually follow the guideline from KKM, how to manage OA. So far, there is 4 stages. Stage 1 is the less severe until stage 4 is the most severe, where the only recommendation from the guideline is that you need to undergo total knee replacement when you reach stage 4. So there's
Wow.
4 stage. How to diagnose? There's 3 ways, but I think most of us, including the audience at home, we can only do one way lah. Okay, so I will
Okay.
list it out anyway. So the first one is what we do in hospital, and it's the most accurate one. What we call image diagnostic. They send you to an X-ray. They send you to MRI. So from there, we can judge what is the distance between both of your bone. Okay, what is the thickness of your soft tissue, and from there we can know and estimate what is the stage. That is one way. Second way is that we do a blood test, but this blood test is not taking from our blood, but taking from the space between our knee.
Wow. Okay.
Yeah,
Okay.
because like what I say, it's an inflammation. When you have
Mm.
inflammation, the white blood cell or immune cell at that area will go crazy. So if we take a
Okay.
sample from the knee and we check, wow, this patient have very high white blood cell count, immune cell count, then we know that this patient is going to develop a severe OA. So that is the
Mm.
second one. And the last one is what we can do at home is the clinical observation. Clinical
Okay.
observation is that, put it simple, there's a few things that will happen when you have OA lah.
Okay.
Stiffness, you cannot bend your knee as good as previously. When you walk up the stairs or down the stairs, you feel the pain and the pressure. So all this is what we can observe at home from ourselves. Every morning when you wake up, do you have stiffness at your joint? You cannot bend. You need
Mm.
to wait for like 5 minutes before you can
Mm.
bend. Things like that we can do at home.
Yeah, so I remember when I was going for this clinical trial, and when I go for the consultation, there's also another patient who joined this clinical trial. I think she was at OA stage 3, so she
Mm.
basically cannot squat down. Okay,
Mm.
she cannot squat at all. And after the clinical trial, she basically can squat again. So I think that is really, really amazing. So
And that patient is actually now selling fruits as a hawker. Yeah, she's taking things up and down daily, and she's resumed her life as a hawker, selling fruits, helping the society and things like that.
yeah,
So
so
that is
it's
something.
really amazing because
Mm,
I think mobility is really important, especially it comes to old age. That time, if we are not able to
mm,
move or to squat or to do our daily activities, is really, really very challenging, especially when you are at certain age, right? So again, when we are talking about regenerative medicine, should I wait until stage 3, stage 4 only I start to do this?
oh, no, 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 no.
No,
Okay.
no.
In
Okay.
fact, that clinical trials we have completed. Okay, we have completed. We are waiting for the final data to submit to Ministry of Health. Because there is a clinical trials, so we only treat patient that is in our list, which is
Okay.
disease. So stage 1 to stage
Okay.
3 OA lah, practically.
Okay.
But in fact, now it's a common service in UMMC, University Malaya Medical Center. And a lot of paying patient now, they come for maintenance, they come because of previously have a sport injury. So you doesn't need to wait until stage 3 because
Okay.
it will just harder for us to manage already as stage 3. So if best, you can come when you already start to feel your knee pain.
Okay.
Okay,
So
not
even before stage 1, like just
yes,
pre osteoarthritis, you can actually start doing it already. And
yeah.
usually, how effective it is, and how long can this sustain?
Okay, so I need to have a disclaimer here where for the clinical trials, we are not using stem cell, we are using exosome. Okay, we are using
Yeah.
exosome. So the effect is faster compared to stem cell.
Okay.
So far from the whole clinical trials outcome, we see that patients start to see positive result within 1 week. within
Okay.
7 days. Mm,
Wow. Wow.
yes.
Okay. So how long will this result last? A lot of patients are thinking, do we need to do it on a yearly basis or how?
Okay. The trials has been conducted for 2 years. So
Okay.
far, no patient come back for the second injection. Okay.
Okay.
If
Okay.
they come back for a second injection, it's for the other knee. It's for the other
Okay.
knee because that knee start to develop OA, but because trial, so we only treat
Okay.
one side, the other side will be payment, something like that.
Okay.
So at least we don't see patient coming back regularly complaining that that leg or that side of the knee is suffering. They always come back, oh, this side settled already, now let's settle that side.
Okay.
But there are patients that don't respond well, but not much. Like all medical treatment, there's no 100%. For this, the success rate is around 90%, 80 something to 90%. Yeah.
Wow, wow. The 90 over percent is very, very amazing
Mm,
already. So
mm.
usually people who don't respond well, is it because it's too late for the therapy
Yes.
or certain contraindication that
Mm.
they
Some
should not
because
do it?
this therapy we only use exosome. Of course,
Okay.
we just secure another 300,000 grant from government despite the pandemic. That shows that how supportive is our government in research. So for that one, we'll add in stem cell. But for the previous trials, we only use exosome, so there is limitation. When come to middle stage 3 or near to stage 4, right, we see result for the first week, second week, but after that the result just subside and go, and then the
Okay.
patient need to repeat inject. So it's not a solution. So that is why we apply for another grant. Hopefully when the research shows that we add in stem cell now, the result will be better, and that I will update you when I have the positive
Wow,
result.
wow, so exciting. So I think it's really, really important to look into preventive
Mm,
healthcare, right? So I think
mm,
a lot of times when we go to hospital, it's like repairing. It's always good to prevent it before it get worse, or sometimes there's nothing much you can do
yes.
uh towards it, because especially if it's too serious already, like you have nothing left there to regenerate
Yes.
again. Okay. So okay, of course a lot of our audience will be also concerned, what are the pricing like when you listen to regenerative medicine, stem cell kind of thing? It always sounds very
Mm,
expensive.
yes.
So how much does it cost to actually inject one of my knee?
Okay, so I debunk the first myth first, okay, where regenerative medicine is supposed to be super expensive, 100K, 200K. Maybe that is the situation 10 years back, okay?
Okay.
But you must remember last time when we buy a handphone, which like a water bottle, that costs 3,000 ringgit, 5,000 ringgit, okay? Only the top rich people can use. But nowadays,
Yes.
handphone is like 1,000 plus, 2,000, okay?
Few
Which is a
hundred also
moderate range.
got.
Yes,
Everybody everybody can afford handphone.
yeah, then I will inject the Air Asia slogan. Everyone can fly as well. Last time only the rich can fly. Why? Because technology improved. When technology
Yeah.
improve, that treatment or that technology will be made more affordable. Same go to RegenMed. Like what I
Yeah.
said earlier, this therapy are even offered in UMMC, which is a government
Okay.
hospital. So how expensive
Okay.
can it be? Of course,
Okay.
if you go, there's limitation because government hospitals sometimes the service is a bit slow,
I
it's a
have
bit
been to
troublesome.
so I have been to the
Yeah,
government hospital. I think it's, of course, it's super affordable to go to government hospital, but the experience is not as pleasant. And like there's a lot of
mm,
waiting, a lot
mm,
of people, and you just need to queue lah. Maybe the whole day you need to stay there lah.
yes.
So for people who are actually doesn't want to go to government hospital, so how much does it cost?
Okay, but the good thing is now the technology is already moving into a lot of different clinics in Klang
Okay.
Valley area. In fact, if I'm not
Okay.
mistaken, over 20 clinics have uptaken this technology, and even some medical center as well. So
Okay.
later I will give a list to Yan maybe. So whoever
Okay.
hope to get this therapy, but not through the government hospital because of the waiting and the experience, you all can visit this clinic. Okay, it's the same
Okay.
technology, but just move from government to private. Of course,
Okay.
then the price is a bit elevated, but it's still very affordable. I
Okay.
see clinic even offer for 5K for a
Yeah.
therapy, but we need to
So
remember, nowadays I see clinic charging HA for 1,000. 1,000 ringgit. Some HA, but that HA doesn't last forever. You start from
Yeah.
3 months once, 2 months once, one
Yeah.
month once, then it
Yeah.
start to every 2-3 weeks. But
Yeah.
this HA might last you quite some time, so
Yeah.
it's worth it lah.
Yeah, so of course, Beauty and Co also participate in this, and I think there are also many other clinics that join Dr. Daniel in this program as well. I think it's really important for all doctors to learn new technology to help uh, patient to get rid of this OA problem. I always say one knee at a time, and this is really important because, like I say, everybody will have this problem, whether it's at their 40s, maybe you are a runner who, that use your joints so much that at 40 years old you're already so pain. But there are people who are at 60 or even 70 years old, and we also see patients who are at their 80 years old. So there are so much of struggle when
Yes.
imagine at certain age, let's say you're at your 70 and you can't really walk anymore, right? But you are still actually physically healthy, just that your leg can't walk. So it reduces your quality of life tremendously.
Yes.
Right.
This why you start from 40, right? Actually, the youngest patient that we have treated is 20 over. It's
Why?
a national
Because of
player.
national
Trauma
player.
injury, yeah. He's a
Yeah.
national player, so he have a trauma injury which takes some time to heal. So he actually come to this technology and use it, and after that, the whole team is so impressed. They say it will be a yearly maintenance treatment for them soon. So we are also looking forward to serve the national team very very soon.
Yeah. So I think it's really, really important, right? Because especially all these athletes, football players, badminton players, they have so much of friction on their joints. It's really important for them to have preventative or even, like you say, trauma injuries. Make sure you really recover from your trauma injuries. I have seen so many people who did not really take care when they have accidents or injuries, and after that, you suffer all this pain in years. If you have this pain, like you say, the accidents happen when at their 20s, and imagine you suffer another 60 years or 80 years if you were to live up to 100 years old.
Yeah, that is what my parents always tell me, especially my dad. He worked
Uh,
as in the construction site.
it's very
So,
soft, Dr. Daniel. You need to speak
oh no, I
louder.
mean this is very related to me as well. My dad used to work in the construction site. He's still
Okay.
working now. So he always tell me that because of a certain injury when he was young, and of course when he was young, that time there's no regen, man. There is,
Yeah.
and as a young guy, you feel that no problem. Next week I can still
Yeah.
work. So, but now when he's 60s, 70s, then you will see every time when I go home, he will just holding at his knee, walking. So, don't repeat that situation. Don't wait until it develop into something very, very devastating. Then only we go for the treatment. We should aim more for preventive medicine or regenerative medicine when we can.
Okay, so thank you very much, Dr. Daniel, for such an insightful information. I think a lot of people still are uh, not being exposed to this new information, right? I think the public are not educated on this
Yeah.
medicine for joint pain. So if today you have joint pain, especially on your knee, tennis elbow and things like that, please, DM us, and we will be able to arrange a proper consultation for you, and to also arrange a qualified doctors to do the injection for you. Okay. So Dr. Daniel, any final advice or recommendation to the audience before we
It's still the
end
same.
today's Facebook
Yeah.
Live?
Monitor yourself well. Don't wait until you start to feel very frequent pain. I mean, when you have pain here and there, you should start to know either go for X-ray or find an orthopedic doctor just to get consultation. If they tell you are already on the way developing OA, but you are now knee pain, not OA yet. So don't wait until it becomes OA. Talk to doctors, and if let's say you are more towards regen person, try to avoid the using of drugs and chemical. Then I think regen med is very established now. So this
Mhm.
technology might be able to help the patient to recover,
Yeah.
to
So
prevent you
I
to
am a
undergo the
yeah.
surgery.
So I am a person who are very sensitive to pain. It's like if my body is just a little bit of pain, I will start investigating.
Mm,
So
mm,
I will actually go x-ray, go to chiropractor, go to physiotherapist, doing massage, doing medicine. So I really hope that by the 100 years old that time, I still can
yes.
maintain physically, my mobility are still good. So I think again, osteoarthritis is the fourth disease that top disease that most of us will face. Like I say, everybody will have this problem. It's just a matter of time. So prevention is always better than cure. Okay, and it can actually save you a lot in terms of pain. So I
Mm,
think if today you already start to have this pain, invest in yourself, and your future
mm,
self will definitely thank you for that. Like me, I am already 40 over years old. If I don't take good care of myself, by the time I'm 80, I'm 90, I think you can't reverse your time anymore, right? So
mm,
it's really important, especially with today's technology and regenerative medicine. Do invest on yourself, especially health, so that the your future self will actually thank you. Okay, so very happy to have Dr. Daniel. Thank you very much. I hope that the next time we meet again, we can talk about how to reverse aging or even sexual health or something. Okay, so
okay.
see what are the regen medicine can help. I'm sure sexual health is also another thing that can regen
Yes.
can help.
Mm.
So anything that we are so afraid of aging, we should look for Dr. Daniel. Okay, thank you. Thank you
Okay,
very
thank
much. Thank
you.
you.
Bye
Bye.
bye.